Good morning, everyone. This is Danielle Leewald, Project Consultant with the Florida Institute for Health Innovation. Thank you for joining us today for our Florida Oral Health Alliance meeting. I'm going to do just a quick roll call, just so we know who's on the call, and then we'll jump right in. So first, I see Erin Messer from the Agency for Healthcare Administration. And just respond here, great. Alexandra Aboud, Florida Dental Association.
Good morning, Danielle.
Good morning. Ben Browning, the Florida Association for Community Health Centers.
Good morning.
Good morning.
Hi, good morning. It's Kristen Garces.
Oh, good morning, Kristen. Thank you for joining.
Absolutely. Good morning, Danielle.
Good morning. Gina Grignon, Florida Healthy Kids.
Good morning.
Good morning. We have Dr. Johnny Johnson on the line from the American Fluoridation Society. Great. Louisa St. Hillian from the Florida Department of Health.
Yes, this is Louisa, and I also have my coworker Jenny Wobbly also with me.
Oh, great. Good morning.
Morning.
Scott Darius, Florida Voices for Health. You might be on mute if we can't hear you. Great. And is there anyone that I missed?
Hi, this is Azam Masood from Florida Institute for Health Innovation.
Thank you, Azam.
Hi, this is Tara Wilson calling from Involved Dental.
Good morning. Thank you for joining.
Hey, this is Justin Manali from the Department of Agriculture, Food, Nutrition, and Wellness.
Good morning. Thank you. Anyone else that we may have missed? Great. So we'll go ahead and kick off the call today. I wanted to introduce you all to Azam Masood. He is the newest member of our team, and he's going to be serving as a project assistant, helping to support the Florida Oral Health Alliance and really all of our oral health work. So we're really excited to have him, and you will start to see his name coming up and more emails coming from him. And Azam has a Bachelor of Arts in Health and Human Concerns from FIU, and he's also soon to graduate from FIU with a Master's in Public Health with a focus in health policy. And we also have Kristen Garces on the line. She is our Chief Operating Officer, and she works very closely with Dr. King in program development, strategic planning, and daily operations for the Institute, and she'll be helping to co-facilitate today as Dr. King unfortunately is not able to join us as he is traveling. And just a couple of housekeeping items. If everyone could just please keep themselves on mute when they're not talking, that would be great. And then if you don't have access to GoToMeeting, you can email Azam and he can send you the meeting slides that you can follow along today. And you should have received an email from him yesterday with the meeting agenda as well. Great. So as we always start our meetings to ground us in our work and why we're here, the result that the Oral Health Alliance is focusing on, which really helps to guide all of our work, is that all Florida children, youth, and families have good oral health and well-being, especially those that are vulnerable. And then as you all are familiar with these are our measures of success to indicate how we're making measurable progress. So the first indicator being percentage of Medicaid eligible children 0 to 20 receiving any dental services, which is now up to 38% compared to the national average of 48%. And then the percentage of Medicaid eligible children 1 to 20 receiving preventive dental services, which is at 36%. 10 percentage points below the national average. Okay, so just a quick review of our meeting results for today. We're continuing with our theme of emerging issues as an ongoing agenda item. So we'll be hearing about some new data, which is the 2016-2017 report on the oral health status of Florida's third grade children, as well as some new tools, which will be the Living Healthy Roadmap GIS tool, which can help inform and support oral health programs and policies. You will also be learning about strategies and best practices to improve access and public perception to community water fluoridation, and that aligns nicely with one of our Alliance focus areas being communications and messaging. And then we'll also talk about how this information and these tools align with the prioritized strategies that the group has selected and each of our focus areas. So in addition to communications and messaging, that being oral health hotspotting and medical dental integration. And then if time allows, we'd also very much like to discuss next steps for the oral health hotspotting subcommittee. So we have a host of really great experts today, and so I will introduce you to our first presenter. Louisa St. Hillian is the data analyst for the Public Health Dental Program at the Florida Department of Health. And in this position, she produces statewide surveillance reports, provides technical assistance, fulfills data requests, and oversees several special projects. And Lisa has a Bachelor of Arts in Sociology from the University of Florida and a Master's of Public Health from Nova Southeastern. So Lisa, thank you so much for being here today, and I will pass it over to you. And I'll be controlling the slides, so you just let me know as you would like me to move forward.
Hi, good morning, everyone. As mentioned before, my name is Louisa, and I'm the data analyst for the Public Health Dental Program. And today I'll be discussing the oral health status of third grade children during the 2016 to 2017 school year based on the results of the dental program's second statewide oral health surveillance of Florida third graders. Next slide, please. Hello, next slide. Thank you. So in this presentation, I'll be giving an introduction on the burdens of oral health disease among children, the method of the surveillance project, the results, how Florida is ranked nationally on the oral health indicators of third grade children, and the limitations of the project, and also the recommendations that can improve the oral health of children in Florida. Next slide. So just to give you a brief introduction, like background on the burdens of oral disease among children. So dental caries or tooth decay is the most preventable chronic disease among young children and adolescents in the U.S. It's actually 5 times more common than asthma. And nationally, in 2015-2016, 43.1% of youth aged 2 to 19 had dental caries. And among children 7, that number rose to 45.2% that had dental caries, and 15.3% had untreated decay. And the rates for Black and Hispanic children were higher than for white and Asian children. So children with poor oral health are 3 times more likely to be poor and 4 times more likely to perform poorly than their healthy peers. And additionally, one study found that parents miss an average of 2.5 days from work per year due to their children's dental problems. And if dental decay is left untreated, it can cause pain, affection, leading to problems with chewing, swallowing, speaking, and learning. And these problems can jeopardize the children's physical growth, self-esteem, and capacity to socialize, and also could affect the overall health status. So a cost-effective way to prevent tooth decay are dental sealants. They could prevent up to 80% of tooth decay when they are placed. And so there are 10 protective coatings that are placed in the chewing surfaces of the back teeth, and that could prevent acid from the leftover food particles from creating holes or cavities in the teeth, and they could prevent up to 80% of tooth decay. But unfortunately, low-income children are 20% less likely to have them, which results in them being twice more likely to have untreated decay than high-income children. And there are, of course, multiple barriers from receiving dental sealants or other dental care, including lack of access to dental services, dental care costs, and inadequate oral health literacy. Next slide. Okay. So for the method of our project, so the Florida 2016 and 2017 third grade oral health screening project was based on the basic screening survey tool supported by the Association of State and Territorial Dental Directors. So the primary purpose of the basic screening survey tool is to provide state and local health jurisdictions with a consistent model for monitoring oral health disease in children. So the basic screening survey captured information on indicators such as untreated decay, treated decay, carie experience, which is the prevalence of untreated and treated decay combined, dental sealants, and urgency for need of dental care, which can either be early dental care need, that means that the child needs to see a dentist within the next several weeks, or urgent care, which means that the child needs to see a dentist when between 24 and 48 hours. So, and dental screenings were provided by the contracted Florida Dental Hygienists Association registered dental hygienists following the basic screening survey protocols. Next slide. So here is the third grade oral screening forms that the dental hygienists use to screen the children. So it has a guide to where to examine the mouth to collect the information on dental indicators, and they can mark off if the child has primary untreated decay, permanent untreated decay, primary treated decay, permanent treated decay, if they have sealants, or the type of treatment urgency. So it could either be no obvious problems, early dental care, or urgent dental care. Next slide. Okay. So the score list, so in order for us to gather the score list, it was gathered from the Florida Department of Education, and the scores were selected using a stratified proportional to size sample design in order to get a representative statewide sample of schools in Florida. So in total, 42 public schools were selected throughout 19 counties within the 6 regions. And selected schools were contacted and asked for consent to participate in the project, and the schools that declined were replaced by another school in the same region. The consent form was sent to the participating schools and distributed to the third grade children. So parents were encouraged to fill out the consent form and questionnaire even if they didn't want the child to be screened, but only students that returned a positive parental consent form were screened by the registered dental hygienist. So there was a total of 17 dental hygienists that screened the children and collected data on the presence of the oral health indicators, and the outcome data were weighted to represent all the Florida third graders, and the data was analyzed using the Statistical Analysis Software, or SAS. Next slide. And here is the consent and questionnaire form that was given to children for parents to sign. So the parents had to select on the first page on the left-hand side, they had to select, yes, I give permission for my child to be screened in order for the child to be screened. And there's also several questions that we encourage the parents to answer for the child, including the child's demographic characteristics, the child's history of chronic conditions, and the development delays, his or her grade, when and why they visited a dentist, dental insurance coverage, and just other oral health related issues that can help us with the survey. Next slide. Okay, so here are the results of we're going to the results of the survey. So this table shows us just the breakdown of the participants. So overall, there was over 4,000 third grade children that were enrolled in the 42 participating schools during the 2016-2017 school year. So more than 1,600 children returned their consent form. but around 1,300 children positively consented to be screened, but ultimately only 1,259 children participated and were screened. So the majority of the participants were 9 years old, female, non-Hispanic white, eligible for free or reduced lunch, and had Medicaid coverage. And the average age of participating children was 8.77 years. Next slide. Yeah, so here's the breakdown of each oral health indicators and the percentage that was found. So 25.1% of third graders had untreated decay. 45.5% of third graders had carry experience. And carry experience, remember, that's untreated and treated decay combined. 40.5% had dental students. 20.6% had early dental care need, and 3% had urgent dental care need. Next slide. I think you skip a couple of slides. She went back. Yes, okay, thank you. Yeah, so when it comes to age, children who are 10 and 11 years old had the highest prevalence of untreated decay. 31.7% of children 10 to 11 years old had untreated decay. And also they had the highest rates of carie experience and early need and urgent need of dental care. But they also had the lowest prevalence of dental sinus at only 32.6%. 9-year-olds had a lower prevalence of tooth decay at 22.8%, but they had a higher prevalence of dental sinus at 43%. Next slide. So when stratified by race ethnicity, non-Hispanic Black third graders had the highest prevalence of untreated decay at 34.6% and the lowest prevalence of dental sinus at 33.3%. So the group marked other was found to have the lowest rates of untreated decay and the highest rates of dental sinus. However, due to the fact that this group is a combination of multiple other racial groups that had a very small number of participants, so the information doesn't really give us a good depiction of the oral health status for each specific group. So after the other racial groups, the second lowest lowest racial group that has the lowest percentage of untreated decay is Hispanics, who had only 20.6% of Hispanics had untreated decay. And for dental sinus, the group other than the other racial groups that had the highest dental sinus is white, non-Hispanic whites at 43.7%. Next slide. So when analyzing the geographic differences of the oral health indicators, the Northwest region had the highest rates of all indicators, including dental sinus. The Atlantic coast had the lowest rate of untreated decay. The Northeast region had the lowest rate of carie experience, and the Central region had the lowest rates of dental sinus. So you do see some kind of a trend, but the next slide. So to compare economic differences, the percentage of students receiving free or reduced lunch at the schools was used as a proxy for individual student income and poverty level. So as you can see, there is a direct relationship between school free reduced lunch status and untreated decay. So as the free reduced lunch status percentage increased, so does the rate of untreated decay. So a similar trend was found when it comes to carie experience. So over half the children from schools that had less than 25% of students enrolled in free reduced lunch had dental sinus, which is the highest, while only 37.2% of children with scores between 50 and 75% of students enrolled in free or reduced lunch had dental sinus. So you definitely do see a direct direct correlation between economic status and oral health, like an oral health condition, and the children and kids receiving dental assistance. And the next slide. So when it comes to dental insurance, you also see a direct relationship of the dental coverage type and untreated decay and dental sentence. So students with private insurance had the lowest prevalence of untreated decay and the highest prevalence of dental sentence, while students with no dental insurance had the highest prevalence of untreated decay and the lowest prevalence of dental sentence. This just shows that the access to dental care and having insurance to cover the cost does make a significant difference in oral health status. And as you can see throughout the many slides, you can see there's definitely a trend between like the group that has the highest percentage of untreated decay also have the lowest percentage of dental sentence. So you do see a correlation of receiving that preventive services and having lower and reducing untreated decay. So you do see that type of correlation. So next slide. Yes. So having toothache, which is another oral health condition, was shown to exacerbate each oral health indicator, as children who had toothaches had a much higher prevalence of all indicators except for dental sentence. So only 32.8% of children who had toothaches had dental sentence, compared to 42.3% of children who do not experience toothaches. So maybe there might be a correlation there that shows that toothaches, children who had dental sentence had less pain when it comes in their teeth than children who did not have dental sentence. So next slide. And so other states across the nation has utilized the basic screening survey methodology to assess the oral health status of third grade children, and the CDC collects this information via the state oral health survey. So the next following graphs I'll be showing are states level estimates for an oral health indicator by states that completed a basic screening survey for their third grade children from 2012 and forward. So we had completed the Florida Department of the Public Health Dental Program had completed an earlier surveillance project for third graders during the 2013-2014, but these estimates have been updated to reflect our most recent 2016-2017 project. So when it comes to dental caries experience, Florida is ranked 6th for the lowest percent of third graders with caries experience among the 28 participating states. So a lower percentage of caries experience translates with better oral health status, and the Healthy People 2020 goal is 49% of 6 to 9-year-olds have caries experience, and Florida is just meeting that goal with 45.5%. Next slide. So when it comes to untreated decay, Florida is ranked 6th highest for the percentage of third graders with untreated decay. The goal is to reduce this oral health condition. So Florida would need to be lower down the graph than higher. And the Healthy People goal is 25.9%. So Florida is just barely meet that goal with 25.1%. Next slide. So Florida is ranked 8th lowest state. It's the 8th lowest state for the percent of third graders with at least one dental sentence. The goal is to increase this percentage as dental sentence is proven to reduce tooth decay. So the Healthy People goal is 28.1% of 9 to 6 to 9-year-olds with a dental sentence, and Florida is meeting that goal with 40.5%. So next slide. So just a few limitations of the project that we had. So the screenings were conducted without the use of radiographs X-rays. So the findings may differ from those observed and diagnosed by clinicians. This survey was conducted only on public school children, so it may not be a good representative of all third grade children in Florida. And the screeners were encouraged to be conservative, so the results represented here may be an underrepresentation of the true oral health status of Florida third grade children. Next slide. Okay. So just a few recommendations for improving the oral health status of children in Florida. So continue collaborative partnerships with school-based dental programs, evaluate and address and overcome barriers that exist in promoting dental services for school-age children, specifically for children from minority ethnic groups and low-income families. Increase the dental workforce, providing school-based dental services, including cost-effective dental sit-ins. Encourage school, teacher, and parental involvement in developing a cultural and linguistical appropriate oral health literacy campaign for school-age children. Increase the dissemination of proper oral health information and resources to children and parents. Promote the benefit of fluoride and the consumption of fluoridated water to reduce tooth decay and shrinking teeth, and continue oral health surveillance activities for school-age children and track progress in the reduction of oral health disparities. Next slide. And that is all. Thank you, everyone. Thank you. So these are so I would like to acknowledge several people, and I listed them in the slide. And to also to read the full report, please visit the Public Health Dental Program website at floridahealth.com dental/reports. And that is all. And the next slide is just my references. So thank you, everyone.
Thank you so much, Louisa. That was really helpful. I would like to just open it up to the group to see if anyone has questions for Louisa.
This is Kristen Garces. I just wanted to add that was fantastic. Thank you so much, Louisa, for sharing.
Thank you. Thank you.
Louisa, I have a question. I think it was really helpful to see how the different oral health indicators, how the results varied by region. I was curious, is there a way to kind of drill down even further to see how those differences are at the zip code or community level?
Well, in order for us to do that, we'll have to gather data from, I guess, the zip code level, and I'm not sure if we're able to do so just.
As of right now, hi, this is Jenny. I was involved in the process as well. As of right now, we're not requesting any address information for the parents, and some of them don't live in the same zip code as the school, so we cannot really drill down to the specific zip code area, and not every county has a site where we did a screening because we did it more regionally. So there's not really a way to kind of break it down more than the region. Hopefully on our future projects, we'll be able to gather more information. It's just been trying to reach the entire state, which is fairly large.
Sure, no, thank you. That's really helpful. And then I'd be curious too to know how the report is being shared more broadly, such as with community members or policymakers, any other stakeholders.
Well, as of right now, we only have the report posted in our website. We did share it with.
We've shared it with some partners and have asked them to disseminate it. And anytime anybody reaches out to us about information, we try to pass it out. We might talk to DOH Communications to see if we could do a press release or something. That might be interesting.
Great. Thank you so much.
Thank you.
Hi, I'd like to ask a question too. If we still have some time for that. I wanted to know. This is Azam Masood from Florida Institute for Health Innovation. I wanted to ask about the public school sample of third graders, and as a limitation, how would you potentially, if you wanted to expand that sample to more children, how do you think would be a feasible way to go about doing that?
Well, we are in the process of gathering the list for private schools and charter schools. So just to keep track of like all the schools. So in the future, we may branch out the survey, the project to go into private schools or in charter schools. But as of right now, we just mainly focus on public schools.
Yeah, and we're trying to increase our sample size. The difficulty comes with finding screeners. Right now, we've been working with the Florida Dental Hygienists Association, but they're limited as well, just because many of the physical screeners also have other jobs. So trying to get them to do screenings for us and with their professional jobs is a little challenging. So we've tried to kind of figure out new ways to get more screeners to provide these services. And so we're in the process of trying to figure out how we can expand.
Great, thank you for letting us know.
Thank you.
Great. If there's no other questions, thank you both so much for your time, and we'll move on to our next guest speaker.
Yeah, thank you for having me.
Excellent, thank you. So we have two guest speakers that will be covering Florida's Roadmap to Living Healthy, which is a GIS tool. And both speakers are from the Florida Department of Agriculture and Consumer Services Division of Food, Nutrition, and Wellness. We have Justin Mandrup-Pelson, who is a GIS technician, and he's been doing map development and analysis for the department for 3.5 years. He started his career with the department developing and refining the first iteration of Florida's Roadmap to Living Healthy, and earned both his undergraduate and graduate degrees from Florida State. And then we also have Allie Caldwell. She's the Special Project Coordinator who's been with the department for over a year. She's responsible for managing the division's special initiatives, such as the Healthy Food Financing Initiative, and she's received her bachelor's in biological sciences from Florida State. So welcome both, and thanks so much for being here.
Hi, Danielle. Thank you y'all so much for having us. We're really excited to share this tool. We've been doing a lot of work on it to get it ready for the release. So we kind of want to first start off by going over kind of the roots of the roadmap and why the Department of Agriculture felt the need to create this tool. Next slide, please. So in 2014, FDEX finished conducting a statewide study to gather information on the food environment across Florida and the health of the residents. So what did the study show us? From the study, it was seen that a number of factors can affect people's food choices and their health. Things such as location, income, education, culture, time, personal preferences, habits, and age were all seen to affect what people ate. Two things commonly seen together were food insecurity and food deserts. These two factors were shown to be key determinants for what types of food people would buy and eat on a regular basis. Findings also demonstrated that having access to healthy food is linked to better health, and this pattern exists in both urban and rural communities across Florida. Next slide, please. So the study was done to address the need to increase access to affordable and healthy foods as a means to combating the growing health epidemic of obesity in Florida. FDEX made narrowing the gap between Floridians and their access to nutritious foods a priority. And after the study, FDEX began setting goals to address these health and wellness issues by creating a plan. 5 main goals were set for the Division of Food, Nutrition, and Wellness, and they are to reduce hunger, improve healthy food access, enhance community health, increase economic opportunity and prosperity for all Floridians, and showcase local leadership and solutions. In order to reach these goals, the Division of Food, Nutrition, and Wellness created a plan. The plan involves 5 main steps, which is gather data for informed decision-making, create tools to facilitate change, foster resources, encourage growth, and support local leaders and solutions. Next slide, please. So here at the Division of Food, Nutrition, and Wellness, we see food as a health issue, which is why our strategic plan involves more than just improving food access. A part of our plan includes providing resources that help Floridians to look at the big picture of health and wellness across Florida, which is why the roadmap was developed. So what is the roadmap? Florida's Roadmap to Living Healthy is an interactive map that provides a new way of looking at information about health and nutrition in Florida by using geographic information systems or GIS technology to visualize data. This innovative tool is a free, data-driven resource and is one of the first steps in helping improve the health and wellness of Floridians across the state. But this isn't the first version of the roadmap. In 2014, FDEX released the original version of Florida's Roadmap to Living Healthy. In 2016, FDEX conducted a study to gather information on how people were using the roadmap, and if they found the tools to be helpful for their use. Through surveys and individual sessions, users were able to express their concern about the original roadmap tool. The study showed that people did not find the map user-friendly, and it was difficult to navigate. They had trouble locating the legend, mapping. Next slide, please. Mapping distances between locations. The data was not organized in a way that made it easy to use. There was no way to draw on the map, and there was a lack of ability to leave feedback and testimonials. To address these issues, FDEX made the decision to create a new Florida's Roadmap to Living Healthy. Justin's going to kind of go over the new tool with you and show you some of the general features of the new roadmap, which addresses a lot of these issues, and then it also provides new tools that weren't in the original model. So Justin.
Thank you, Allie. Next slide, please. So what is in the roadmap? Let's take a deeper dive into some of the new features that will be in the newest version that will be released. Next slide. So there are several ways that users can view the data in the new roadmap. We have tabular reports in which users can view the raw data. We have visual infographics that offer pre-canned data for you to view in a visual way. And then we have the overall GIS map. Next slide, please. So as Allie mentioned before, the new roadmap has many improved features. The roadmap has over 25 recently updated data sets that relate to health and wellness in Florida. And one of the newest data sets contains data provided by the county health rankings and roadmaps. And from this, though, we realized that this is just a lot of information and it can be difficult to sort through. So the data layers are now organized into 5 different themes. And the themes are demographics, economics, health, food access, and education. And just as an example, the health theme contains data layers such as selected healthcare facilities, recreational opportunities, diet-related deaths, and many other statistics relevant to health. Now, this makes it easier for the user to look for information on topics that they're most interested in. We also do have an all theme, though, which will allow users to select any of the data layers that exist within the roadmap. There's also a helpful Learn More feature that allows users to see what data layers are featured in a theme and what source that information came from. Next slide, please. So the map is highly customizable as opposed to the last one. Users can select different base layers, which can change the look and feel of the map. Multiple data layers can be selected at once and layered on top of one another, or users can view all of the data at one time or just one at a time individually. And by using the map control panel, users can zoom in and out on geographic areas, they can mark their current location, and they can toggle through previous map views. And the search feature allows users to view the map by either a specific address, by county, by city, or even down to the zip code level now, which was the most requested of our previous users. Next slide. The map also contains pop-ups that will allow users to view the details of each layer. Mostly this is locational data, and users can also generate reports from here or view the raw data in the attribute table. Next slide. A drawing feature is now also available, so users can highlight areas of interest using 9 different shapes and lines. It also allows the user to write text on the map or drop their own individual markers at any location that they desire. And a measuring function is one that allows users to measure distance or area by miles, yards, kilometers, whatever they prefer. And all this combined makes it easier to locate gaps in service and see statistical trends in a specific area or across the entire state. Next slide. There's a toolbar at the top right corner of the map, and it contains multiple functions that are all accessible by just the click of a button. Some of these features include bookmarking, which allows the user to save a specific map view during their session, as well as they can now export the data, which was probably one of the biggest things that we had was people would ask us for the data, but we didn't have a way for them to just easily download it from the site. And now they can also print the map too, which was notably absent from the previous version. And all these features are designed to make the map more user-friendly while also enhancing the user's experience. Next slide, please. Users can also now view and export the data from the attribute table. The attribute table will appear under the map at the bottom of the page. Here's where users can filter the data to show precisely what they want to see and then export it to a CSV right from the application. Next slide. And one of the biggest features we have now is a reporting feature. The reports allow a user to view the data in a more traditional way. We know a lot of people just like to have their hands on the data to be able to, just show the information that they've gained from the roadmap. And users can generate these comprehensive market reports from the data layers that are available in the roadmap application. Users can create reports from either predefined areas like a county or a zip code, or they can create their own custom areas in a tabular report. And these reports can be viewed, saved, or printed as the user wishes. Next slide, please.
So as Justin had mentioned before, there is an infographic section which is new to this version of the roadmap. Although the roadmap does not make custom infographics, it does contain pre-canned infographics. These infographics are made up of the most used roadmap data, and they're data within all of the themes that we have mentioned: food access, health, demographics, economics, education, and that type of stuff. They are there to give people an idea of how they can show data in a different way to really tell a story. Because we do know that not everybody is a numbers person. They can't just look at a table or maybe even just a map. So we wanted to be able to give users an idea of how they can make this something that is even more visually appealing to really bring the story that the data tells to life. Next slide, please. One of the big complaints that we had originally had was there was no way for users to actually communicate with us here at the Florida Department of Agriculture about any questions they had or leave us any feedback or testimonials of how they used the map. So if you have questions while using the roadmap, there are multiple tools to help. The FAQ section provides quick tips about common questions. A complete user manual gives step-by-step instructions for using the roadmap, and this is something that we had before, but it was not in-depth enough. And help videos throughout the actual GIS map give users a guided tour of the map. And it's Justin's voiceover, and he walks you through how to use every single section of that map tool. And we also have a webinar section, which allows users to view previous webinars or sign up for upcoming webinars about the roadmap given by the roadmap team. So next slide, please. So public users are able to do a lot with the roadmap, but champion users can do more. Champion users are people or organizations that have created an account with Florida's Roadmap to Living Healthy. These users can be anyone, a GIS specialist, a health professional, a community advocacy group, or leaders, etc. Most importantly, it's free to become a champion user. Justin will tell you more about these champion user features.
All right, next slide, please. So perhaps the biggest benefit of being a champion user is that these users can add their own data sets to the map that will overlay with everything that's already in there. This includes uploading layers from ArcGIS Online or loading URLs. This will be primarily beneficial to GIS professionals like myself. Or you can just upload regular files like shapefiles, CSV, KMLs. It accepts all those. File uploads are limited to 5 gigs or 5,000 data points. This data will only be visible to you and can be removed just as easily as you added it. Next slide. Champion users will also have access to our open data portal in ArcGIS Online. This will provide users with our fully formatted data layers and all the associated information. Again, this is primarily beneficial to GIS users, but it is available to all champion users as well. Next slide. Champion users can also create their own customizable reports. These will look like just the ones that the public users have, except this one you'll be able to incorporate your own data as well that will be inserted into it. The data will be noted by UUD, or user uploaded data, and the file name that you select. Next slide, please.
So here at the Florida Department of Agriculture and Consumer Services, we are working to create a positive change in Florida. This includes providing resources that allow for people to make better, more informed decisions for themselves and their communities across the state. We would love for you to become champions of the roadmap and leave testimonials about how you use the roadmap to help improve the health and wellness of Floridians in your community. The map is set to release later this summer, but if you would like to become a champion user and leave feedback and testimonials about your experience with the roadmap now, we can release the roadmap to you for use before this launch date. Remember, becoming a champion user is free, and we would greatly enjoy working with you to accomplish our goals and improving Florida's communities. Next slide, please. So if anybody has any questions for Justin and I, we would love to answer them for you at this time.
Thank you so much. Yes, if anyone has questions, please jump in.
This is Kristen Garces. I had a question. You had mentioned, and if you could talk a little bit about, you mentioned in one of the first slides that you would like to use this tool to show to help showcase local leadership. And I would like if you could maybe talk a little bit about where you are in that process and perhaps maybe the success or best strategies you've discovered in getting local leaders to set commitments to using this.
So as you know, we have not released this tool yet, but this is why we are approaching you all, is because we would like for you to be able to use this tool. In the past, when the roadmap first launched, we did have different partners that we had originally used the roadmap, but we are actually looking to kind of branch out further, less in our comfort zone, which is, generally food, and work more with, health industries, including oral health, to have users kind of take the roadmap for a test drive and leave testimonials of how they've been able to use it to improve their community.
Great, thank you.
Are there any other questions? I'd just like to jump in. I know I could see this tool being really valuable, especially for some of the work that our grassroots partners are doing. We don't have any members from Catalyst Miami on the call today, but they've shared with me some of the projects that they're working on in terms of trying to integrate more oral health and nutrition education in District 2 schools within Miami-Dade County, especially within communities that are located in food insecure areas. So I could really see the potential for using this tool to kind of showcase and advocate for programs like that. And I'd love to hear any other like success stories that you've had from organizations that have used this tool as well to advance their work or advocate for community programs.
Yeah, I know we've worked in the past with the Florida Heart Association. They used to be a big user of this to help see recreational opportunities across the state. I mean, there's thousands and thousands of parks across the state of Florida. I know that they were able to figure out that I think 92% of all Floridians have access to some sort of recreational or exercise opportunities within the state. I know one of the big ones that we see is SNAP participation. We had, I think, a convenience store chain in Jacksonville reached out to us and wanted to use the roadmap to be able to determine, areas of need in Jacksonville and to see if they could get some sort of healthy, fresh food alternatives in their convenience stores, if that would make a difference towards kind of bridging a gap of a lack of access to healthier foods in lower income areas. So those have been like two of the primary examples that we've seen. But again, like Ali said, we're really looking to branch out here and get more success stories to see how people are able to utilize the tool and how it helps improve their communities.
Jason? Hello?
Hi, yes,
Yes.
is there a question?
Yes, Jason. Johnny Johnson. In Virginia, they use GIS information for tracking fluoride levels in water throughout the entire state down to the well water level. Is that something that this is going to potentially be used or can be used to have data inputted into it?
Yes, actually, as a champion user, you can upload your own GIS data into this.
Okay, that's above my pay grade, but I was just curious. Well, that would be very, very helpful from a water fluoridation standpoint, or fluoride levels. Thank you.
And we know that, we kind of come from a food standpoint, but we really we have more data layers than just pertaining to food access. We have data layers pertaining to health information, education, economics. It's over 25 data sets just starting off with, just to kind of see how that works out. But we would love for people to be able to become champion users, add their own data sets, and make comparisons with different ones to see any sort of gaps in service within their field of expertise in order to find solutions to close those gaps in service. So this is really a resource tool that we feel can be used in multiple different fields.
Excellent. Thank you both so much. Are there any other final questions for Ali or Justin? Thanks. We appreciate you being here.
Thank you.
Thank you.
And if anybody has any questions, please feel free to contact us. Danielle, would you mind giving our contact information out?
Absolutely, yes. We will be disseminating the meeting slides so everyone will have your contact info.
Excellent. Thank you so much for having us.
Thank you.
Great. Thank you. So our next guest speaker, which many of you may know, is Dr. Johnny Johnson. He's a pediatric dentist and the president of the American Fluoridation Society. He also helped to found the American Fluoridation Society in 2014, which is focused on defending, protecting, and expanding community water fluoridation. And the group also helps communities across the country and internationally with credible documentation of the science which supports water fluoridation. So we're excited to have Dr. Johnson here today, and I will go ahead and hand it over to him.
Thank you, Danielle. Again, I'm a pediatric dentist from the private practice sector, not in public health, but became involved in public health with water fluoridation. I'd like to let you know that, first of all, what I'm not going to talk about, one is that we know that water fluoridation is one of 10 greatest public health achievements of the 20th century. We know that it's effective, it's safe, it reduces cavity rates for everyone simply by drinking the water. It provides for huge cost savings for families, not having to pay for cavities, missed work, so on and so forth, as well as it helps to prevent the most disadvantaged, which have a disproportionate burden of cavities. It helps them to, as well as us, anyone, to prevent this infectious and transmissible disease by a great percentage reduction. Water fluoridation is backed by leading medical and health organizations, including the American Academy of Pediatrics, the American Dental Association, the CDC, Mayo Clinic, and the World Health Organization, just to name a few. And water fluoridation is not opposed by a single credibly recognized medical and health organization in the entire world. Next slide. Today, I do want to talk about where the rubber meets the road. Determinants in preserving, restarting, and water fluoridation happens to be where fluoride science meets political science. Who is involved in the process? Collaboration of private and public health sectors. How to move the needle forward in Florida. I did send some pre-information to you on statistics of where we are in Florida on water fluoridation percentage-wise. I also want to compliment us all on being above the national average of we're about 75% of the U.S. On community water systems is fluoridated. In Florida, we are at 77%, and we're going to continue to increase it. As well, I sent just a single piece of information that those opposed to fluoridation have begun to heavily use, and they, as well as a debunking piece of that from the American Fluoridation Society, they are using the race card heavily against the African American community and the Latino communities to scare them into thinking that community water fluoridation is extremely harmful to them, which it is not. Next slide. We have to find out where water fluoridation decision makers stand on water fluoridation. We also have to know that their staff, the people they depend on for information, and who they go to for answers, where they stand on this information. That does include the city and county administrators, whichever decision makers are making it at that level. Next slide, please. In establishing the position on oral health and water fluoridation, we have to be preemptive in our approach. This applies to those running for office as well, finding out what their position on oral health and specifically water fluoridation is. Next slide, please. This is what a reputable, credible water fluoridation decision maker will do in speaking up for a positive public health initiative, whether it is water fluoridation, whether it is public roads, public libraries. They will state it as it is. Next slide, please. Too often, this is the pro-fluoridation's advocate chair. You have to step up. You have to become involved. And if you don't, we leave those who oppose water fluoridation to be the experts, which those who make decisions will depend on for information. Next slide, please. Water fluoridation decision makers are hired, if you will. Personal activism by the private sector can make that stay or go away. Next slide, please. In the case of Pinellas County in 2011, where they voted fluoridation out by a vote of 4-3, the 3 people on the right, X'd out, got voted out of office. They were fired over their positions. The gentleman on the top left changed his position, and he's a good friend of mine, and he passed away, and I'm not able to be at his funeral today, but he is a gentleman that changed his mind and voted it back in. And as you can see, personally, we sometimes have to become involved. That is me. I'm outside a polling place, and this was from a local newspaper which pulled this. I was helping 2 candidates run for office that were going to bring water fluoridation back, and that was their sole platform, was to return water fluoridation. Next slide, please. The media has a huge role in informing communities on their health, safety, and well-being. Get to know the media, get to know the reporters and editors. In some communities that are small, those are the same departments. They talk to each other. In other larger communities like Pinellas County and large areas, they will actually stay separate. So it doesn't appear as though the editorial side is influencing the reporters. Next slide, please. And here is what happens when responsible reporting occurs. And this was a highest of awards that these gentlemen received, a Pulitzer Prize for their editorial writing series on what happened in Pinellas County during the year that we did not have it. Next slide, please. Let's talk about water personnel for a second. Never take water personnel for granted. We are very intimately involved with water personnel in water fluoridation. It's very important to tap into these folks to help water fluoridation remain in place or get started. Next slide, please. Get to know them. Never take for granted that they are just doing the job the way it needs to be done. They're providing safe drinking water for us. If they're fluoridating the water, they do it because they are told so. They're not required by the Environmental Protection Agency, so it is an extra job for them. We need to educate them in the huge role that they play in the public health setting. The number of cavities that they reduce is probably more than all the rest of us. Can you hear me?
Yes, we can hear you.
Okay, I'm sorry. I thought someone said something. We must educate them in the role that they're playing in public health. They absolutely do not know that. They are not aware of what they add a small amount of fluoride to water, how it impacts a community's health, dental health. Next slide, please. Here are just a few examples of misinformation and fear-mongering propaganda that water fluoridation opponents put out. Water operators and water fluoridation decision makers are bombarded with this information constantly by email. They are the ones that are helping, so to speak, the water fluoridation decision makers and water operators to know that there are ills caused by water fluoridation. There are no ills caused by water fluoridation. Next slide, please. Water personnel are the trusted experts and relied upon by their water fluoridation decision makers. Next slide, please. Anti-water fluoridation water personnel can single-handedly end water fluoridation. They will use some of those previous claims that I showed you to help to convince the water decision makers that that is inappropriate. It doesn't work. Toothpaste does the same job. There's no reason for it. And they will go so far as to even sabotage equipment to cause it to fail, to help their decision makers decide not to continue it, saying that it's breaking down our equipment, and simply what they're doing is not maintaining the equipment. Next slide, please. There is a plethora of resources out for you to call upon and to use for help in water fluoridation. Our group, which is young, we have been officially on the radar for 3 years. We have been doing this forever. We have a website that has every claim that's made against water fluoridation addressed and scientifically referenced. We provide technical assistance to any community. We also, if requested, will provide boots on the ground expert testimony. We offer statewide stakeholders training to teach and empower advocates to fight the fight. We are funded by Delta Dental of California's Research and Education Fund, and we do all the work that we do at no cost. They fund us to travel and to be able to go to communities that need experts on the ground to refute and show that the opposition is telling nothing but improper information. A couple of other resources available that are very, very good as the ADA, American Dental Association Fluoridation Facts, and the Florida Dental Association has a fluoridation website that is chock full of great information. Next slide, please. So, is your water fluoridated? Do you think it's appropriately fluoridated at the right level? 0.7 parts per million. Well, you might be surprised. The way that you can immediately find out, and I would like you to do this today, is to go pull your annual water quality report. You can get it online. You don't have to find out when they mail it to you, which will be once a year. You may be very surprised at what you see. At a level of 0.7, which is a target sweet spot for stopping cavities, you will see that communities will put anywhere between 0.4, 0.3, 0.8 parts per million. Purposely, communities and water operators at times will under-fluoridate. And that is for different reasons they'll give you, but many times it is to save money and to make their department look as though they are more efficient and having less money to spend in the upcoming budget. Go check it. If there's a problem, you can contact the Public Dental Health Program, or you can contact me. I am in Florida. We do work across the entire United States, and we also work with our international partners, but Florida's my turf, and I'm here to help you. Next slide, please. Thank you all for having me today. Happy to be here. Happy to answer any questions that you might have.
Thank you so much, Dr. Johnson. It was very informative. I will open it up now to any questions. I know that Oral Health Florida has several efforts, including an action team focused on fluoridation. So I'd love to hear, I believe Karen Hodges on the call. I'd love to hear a little bit about some of the recent initiatives and how folks can learn more about that.
Hi, this is Karen. I wasn't expecting to have to talk at all. Some of our recent initiatives, well, we just had a little something going on, you know, up north in Madison. But, you know, basically, you know, what we're doing, of course, we have our you know, calls, but it's more about organizing people when we get like these, I don't know what, issues in different areas, and it's really about organizing people and getting everybody together and trying to figure out how we're going to tackle it. You know, if it's, you know, figuring out who needs to reach out to who, you know, in order to get things moving, you know, getting them materials that they need or information. You know, that's pretty much, you know, where we're at with that in terms of our action team. We have, you know, regular conference calls, and we do have work with the Florida Department of Health and we've got our managing director, Deb Foote, has been working on a lot of things, you know, to identify areas that, you know, could have some help with initiating stuff and initiating the water fluoridation, or, you know, figuring out who needs the information, that sort of thing. So that's basically what we're doing on our end.
Great, thank you, Karen, for sharing that.
This is Kristen Garces. I had a quick question. How I had an opportunity to read through some of the attachments about the the Fluoride Action Network. Dr. Johnson, how successful have they been in selling this information? And could you maybe touch on the motivation behind distributing the misinformation?
Let me tell you first about the motivation. The lead on this nationally and internationally is a PhD chemist. It changes from time to time depending on if a person passes away. Only God knows, honestly, what that person's motivation is. The rest, the rank and file, are like a cult. They will follow, they will believe, they think this is a huge conspiracy that's been covered up since 1945, that we have in the entire world, we've covered it up, and that it is a failed public health policy that does not work, and why are we doing this? So it is replaced to people's emotions. It's easier to scare people than it is to unscare them. Now, how successful have they been? They have been hugely successful in getting rollbacks in communities. And the reason being that this falls on the local dentist and the local communities, the hygienists and healthcare professionals to defend water fluoridation in a community. We were taught water fluoridation in school. We were taught that it works and that most of the United States has it. And we are not taught on the misinformation that's out there. So when we began our group, it was a group, there's 4 or 5 of us that were board of directors. We do not have any members. The purpose for that is we hide our people who donate to us behind, other than our Delta Dental of California, that's up front. But if someone buys a t-shirt and we make a couple bucks on it, those on the 501c3, those people would be absolutely, their names would be given. We are 501c4 to hide those folks. And the reason we do that is because people receive threats. And the threats can be as little as basically threatening you with trying to get you fired from your job, to anywhere up to and including death. And we did not want to expose anyone else to that. We are exposing ourselves, and we do not care. That is something, when you believe in something strongly, you are believing against something strongly. Now, their success rates, they used to be good to real good, but now with the formation of the American Fluoridation Society being a rapidly deployable group, we have turned the tide. In the last 5 to 7 years in Florida, we have a record of at least 11-1 wins against these folks that are trying to stop fluoridation. And that includes stopping it, restarting it and initiating it. Now, I do want to compliment the Department of Health with the backing of AFS that we will handle all of the anti-fluoride information. The Department of Health, our county health directors are stepping up, and they're able to now engage, educate folks and the decision makers on water fluoridation, and we go along with them to refute with scientific evidence of what the antis are saying and why it's incorrect. So we're beating them. We're beating them.
And just one more follow-up question: Has this group perhaps been invited to participate in the scientific process and the data analysis process that supports fluoridation? Because I feel once you are actually exposed to the process and the analysis and can see firsthand that the justification for the support, that it would not give them the space for being anti-fluoridation.
Well, that would be using common sense. And the folks that are adamantly against it, and it is a handful of people that now have a larger appearance because of the internet. They used to have to go to city commission meetings. This began in 1945 when water fluoridation began in 1945. They have always fought against it. They include scientists. They include one top scientist who was on the National Research Council's 2006 comprehensive review of the EPA's maximum allowable fluoride levels in water in the United States, and that's 4 parts per billion, and that is 6 times what is in water fluoridation. Some of these people have gone dark for some reason. In other words, switch sides. They will never change. They are constantly using information. Right now, they know that they have nothing that backs up IQ damage from fluoride in water, fluoride levels at water fluoridation. Yet their move right now is to scare mothers to death, pregnant mothers, that it is damaging their unborn children. And they're using data that is not applicable to water fluoridation, but they will pull information from any source and abuse it, cherry pick it, mix it with their own opinion, then pour it out over everybody and an unsuspecting public to cause fear. Will you change any of these folks? Maybe 1 in a million, honestly, 1 in a million. You will never change. They will adamantly go against any science that comes out and say that it's flawed. It's been bought for by big pharma or by the phosphate industry, where we get most of our fluoride additives from. These people you would suspect would listen to reason. They have a mission, and you don't change them. You just cannot change them. We would love to. It just doesn't happen.
Thank you very much for the explanation.
You're welcome.
Dr. Johnson, I had one additional question. Could you tell the group a little bit about the Community Water Fluoridation Training Corps program and what that training entails and who it's open to?
Oh, absolutely. We went on the offensive this past grant process, and we decided that it was time to help states to be able to pull together stakeholders, the Dental Association, Hygiene, Academy of Pediatrics in that state, health groups, children's and adult health advocates, as well as even citizens that are residents that are in the communities. What we did was to develop a program that is tailored to those that know something about fluoridation, but you don't have to know anything about it. What we do is to offer this training. We did one here in Florida in February of this year, and we have we actually have an in-person training that's 3.5 hours. Sounds like a long time. It flies by. We train on the information on what those who make claims say, what the actual science is that backs the credible information that they are incorrect. We offer communications discussions on how to communicate appropriately, or I should say in a better manner than we do when we're in public speaking to groups, whether they are public health officials or, excuse me, public decision makers, whether it is a religious group or a service group. We go through a exercise at the end of it. We will have a table of a maximum of 20 people. We give them scenarios to go through, and they have to come up with answers and get up and speak to those groups. We give them, say, 2 minutes for 2 people to get up and speak to a group of ministers who have heard that water fluoridation is causing IQ problems, and they're concerned about it. So we do a lot of practicing, but we also open that training to anyone that would want to come in and be an observer. So those observers are getting all of the same information. They're watching those that are seated that are going to be picked. They have picked themselves basically as the biggest advocates, and they watch how this training goes on. So all of the information that we do at these trainings is available to everyone afterwards. We also follow that up with a web phone call, and what I just showed you, this piece is our webinar that we go through with the community. We do that a few months later to check in and see how what questions there are, what may have come up, and basically we are constantly giving information. That is a separate program from what the American Fluoridation Society is constantly doing, and that is you contact us about something like Karen Hodge was mentioning. City of Madison had a water fluoridation issue that was learned about 2 weeks ago, where they stopped it. Well, they stopped it because the city manager told the water operator, let's stop doing it. She was against it. The health department found out about it. Oral Health Florida, ourselves, AFS, and Florida Dental Association all became rapidly involved, and as many other county health administrators have demonstrated. Kimberly Albritton in Madison County and Jefferson County, she's over both. She quickly activated to gather information, found out what the issues were, and within 1 day's time, the water fluoridation was restarted. 9,000 people depend on it, 7,000 to 9,000 people depend on that water. So our training, even though Kimberly wasn't there, that is the type of training that is open to health departments. It's open to all the groups I was saying, to teach them to run to the fire and not to run away from the fire. And it is easiest to be afraid to go. And that's why that empty chair was shown. That's what's gone on in the past. That is no longer the case. Did that answer the question?
Yes, thank you.
You're
Thank
welcome.
you very much. Does anyone else have any questions for Dr. Johnson? Well, thank you so much for your time and for sharing all of that helpful information with us.
My pleasure. Thanks for having me. And anytime, we're always here.
Great, thank you. So we wanted to just quickly open it up to everyone on the call to kind of weigh in on how some of the resources that you learned about today could help inform some of the work that your organizations are doing, and then overall state programs and policies. And just hear from you all, and were you aware of those resources, and how perhaps you can anticipate kind of applying them to what you're working on. So I'll just open it up to the group.
If no one else will, I guess I can add something. Dr. Johnson's very detailed breakdown of water fluoridation and sort of how we can change people who are still not necessarily change the people themselves, but vote them out. I think it ties back into our need for when we're doing communications and messaging to focus on civic duty on the local level. Telling people they have to vote is nice, but we got to be more specific and give them the information about the people involved in issues such as these. So I think it's important that we really start messaging and getting people involved, so we can get the right people in office who can help us with promoting water fluoridation.
I will look, this is Johnny again. I will tell you absolutely 100% that a grassroots effort and a constant education level by those that are in public health or in education, there's a line between advocacy and education, and I understand that in Florida very well. There's things that can be said, but some things that can't because they border on a political activism. And there have been Department of Health folks who have been kicked out of meetings because of in Avon Park, because they said, this is political, you can't be here. This is a game. Grassroots efforts made in communities definitely falls in the purview of the public health department. You all know your communities better than anyone. And speaking about oral health and dental health is a huge, it makes a huge impact on how a community comes together. And then those that are very, very helpful in pushing this over to the advocacy side is the private sector. We can do this. We can advocate. We can speak up against those that are opposing it, and including water fluoridation decision makers, as in Pinellas County, as in Brooksville, as in Wellington, Florida, many, many communities where we have fought the battles. We can do that from a private level, as from the Department of Health folks in Brooksville, Florida. The mayor, who was totally against fluoridation, said when they spoke, Department of Health said, we'd like to educate you on fluoridation. She turned around and said, I could educate you. We're not going to talk anymore. So it's a public and private marriage that has to go on in this. And I could speak many, many hours on this, and that's why I say a short presentation is difficult to do, but we are here to be the voice of the private sector, and we can do that and are happy to.
Very well said. Thank you, Dr. Johnson. And I have to admit, hearing about the fringe people is honestly depressing. But I agree, we still have a role to play in all this.
Well, they in just a couple words, those are the same folks that are anti-vaccine. In fact, they have joined forces, the anti-vaccine group, the anti-fluoride group, those saying that contrails in the sky are being put out to destroy our brain cells. If you ever have watched or haven't watched Dr. Strangelove, go back and watch it. I didn't realize when I first saw it, that movie was entirely about water fluoridation, entirely about water fluoridation. Very good movie. But it is the anti-vaxxers. This is just, if you change fluoridation with vaccination, you'd have the exact same scenario. You're not, if somebody's anti-vaccination, you're not going to change those people. It's rare.
That's true.
Great. Any other thoughts, comments, feedback from the group? Okay, then we'll use the last half hour to talk a little bit about our oral health hotspotting subcommittee. These are some of the discussions that began earlier this year. And just as a refresher, we talked about this as the goal really is to move from talking about this work to taking action through implementing some of the strategies that were outlined in the Florida Oral Health Alliance strategic plan. So we designed the goals and objectives, really wanted to make sure that the subcommittees that we selected fit into the statewide landscape and also aligned and enhanced the work of our grassroots partners. And hotspotting really helps us, instead of moving forward towards broad strategies, it helps to focus the limited resources we have to key areas to make the largest impact. And it also can help to inform our research agenda, so an opportunity to understand what the root causes of these hotspots are, and also could be powerful in advocacy work, helping to get legislators more involved, to be able to show visually that within their district there may be major oral health hotspots that need to be addressed. So we had outlined the goals and objectives that you see on the screen and possible proposed deliverables as part of the work of this subcommittee. But we wanted to use an opportunity to kind of get more defined in how we're moving forward, and to see and gauge how this group would really feels how we should focus the analysis. So of course, there's a wide range of things we can look at, whether that be clusters of disease or high rates of ED utilization due to oral health issues, but wanting to kind of take this time to kind of gain some of your insights and feedback on where do you think, where would this work be most helpful, and some of the direction that you feel we should take to move forward. So I'll kind of stop there and open it up for comments and feedback.
This is Johnny. Let me just say that what we all know is that we are into prevention. The information that was presented at the very beginning of this program was very sad, and we all know it. The amount of untreated decay in children, we have the same type of untreated decay in adults, and preventing that type of decay to a level of at least 25% to 70% by water fluoridation is just, it's a no-brainer. I know that we are focusing, and very well, we have so many needs and such an underused Medicaid system that there are problems that we have to solve to get those folks to be able to get care and follow up with it. But to take fluoridation to 100%, and we are getting there. I showed that in one of the new pieces of equipment and tablets that have come out to help make fluoridation more simple. It is something that is going to be a huge bonus to us here in Florida, as well as the U.S. and around the world, that it will help to fluoridate small communities. And that's primarily what we're missing. We've got our poorest communities, our poorest counties are where we need to have water fluoridation implemented and continued. And this type of a system, as well as a push to get fluoridation in place, is going to reduce the burden of disease that we have to fight. But that is where I am at with this, and you all, bless your hearts for everything you're doing. I have the utmost respect.
Thank you for that feedback. Any other comments from the group? Okay, with none, we will close out in discussing our upcoming meeting. So we just wanted to share with you that this meeting is taking place of the meeting, our June meeting that was originally scheduled for the end of this month. So our current schedule now puts us at the next meeting being Friday, August 24th. So we know that is quite a large gap between now and then. So we just wanted to see how folks felt about that timeline and if there was a preference to schedule something or move that up perhaps in July, or how that works for the group. So if anyone has feedback or comments, preferences, please share that. Okay, so we can certainly send out a doodle poll to the group just to make sure that we have a schedule that works for everyone. Moving forward, just to close out some upcoming learning opportunities, and as I'm sure most of you are aware, the Oral Health Florida Conference is coming up on July 24th, and today is the last day for early bird registration. And the focus is on shaping the future of oral health, and that will be held in Orlando. And also wanted to inform you that we are working to plan a webinar, which will be training folks on how to use the Oral Health Needs Index tool. So several of you may be familiar with this tool as you had participated in some interviews and surveys during the evaluation of the beta version of the tool. So basically, this tool is designed to be an easy access, place-based analytic tool. There's resources that link environmental and social determinants of health, health behaviors, healthcare access to oral health outcomes, and it's a partnership between Texas Health Institute, Critical Learning Systems, McNary, and the National Communities Mapping Institute at Meharry Medical College. So just stay tuned from us. We'll be reaching out and providing an opportunity for folks interested in learning how to use the tool with the developers. And as always, opportunities to stay plugged into oral health best practices happening across the country. You can connect to the Oral Health 2020 network. There's a link there. We have a Florida State page too, which we're beginning to utilize even more strongly. So that is just a resource to be aware of. And there's a lot of great webinars as well as reports and best practices from how folks are advancing oral health across the country. Before we end, just wanted to see any other questions, comments from the group before we close. Well, thank you everyone for taking time on a Friday to join us today, and thank you so much for all of our guest speakers. We will definitely be sharing the meeting slides and all the resources we talked about today with everyone. So thank you, and hope you have a great rest of your day and a great weekend.
Thanks, everyone.
Thank you, Danielle.
Thank you.
Thank you. Thank you. You too. Bye-bye.
Thank you.